In the first few days of the illness, if the doctor feels appropriate, only then remdesivir is to be given and not to be given to everybody. It is not a Ramban.
Many patients have started keeping oxygen cylinders at home and have started taking it for half an hour, 2 hours. That itself is more harmful.
In any country, any part of the world, there is X amount of oxygen available as a as production. Today, we have enough oxygen if we try to use it judiciously. We don't want to waste oxygen. So the protocols for oxygen use and the response to what level we want the oxygenation in a patient to be, and the fact that I would like to inform the public also that if you don't need it, don't use it just for a security blanket.
Oxygen is a treatment. It's like a drug. And therefore, it's very, very important for us to understand that one of the treatments for COVID-19 is to give oxygen if you need it. And in many lung diseases, when you have pneumonia, when you have chronic lung disease, when your saturation falls, oxygen is a treatment that is given sometimes for a short duration, but sometimes people are on long-term oxygen therapy if their lungs are bad because of a chronic lung disease. Now, an important issue here is that taking oxygen intermittently. Your saturation is all right, but you say, okay, let me take oxygen for half an hour after my meals, or if I take oxygen for a few hours in the day, my saturation goes up and I'm feeling better and I should therefore continue oxygen, is actually a waste of oxygen. There is no data to show that this will be of any help to you, and therefore this is something that you should not do. Many patients have started keeping oxygen cylinders at home and have started taking it for half an hour, 2 hours. That itself is more harmful. Oxygen is carried in our blood, and we look at what is the oxygen which is carried in the blood by looking at the oxygen saturation. But if your saturation is 92, 93, or your saturation is 98, 99, the actual oxygen in the blood is not very different, because the oxygen dissociation curve is what we call a sigmoid curve. And after you reach a saturation of 90, it is actually flat. So you don't really get too much of oxygen in your blood, even if you go from 92 to 98. Therefore, in those individuals who are having an oxygen saturation of 93, 94, there is no need to really take high oxygen or high flow oxygen just to maintain your saturation at 98, 99. It is not going to be of any benefit.
Now, you may have heard there was a shortage of remdesivir available. So I want to address the fact, when do you need remdesivir? We have now made a protocol that remdesivir is to be given not to everybody who will test positive, and that misconception I would like to take out of people's mind. Only the doctor will look at a set of test results and a set of symptoms which show that a person is experiencing a viral load which is giving them high fever. So in the first few days of the illness, if the doctor feels appropriate, only then remdesivir is to be given and not to be given to everybody. It is not a Ramban, and it is only effective in decreasing the viral load in the people who need it.
The first, of course, most important thing to understand is that in COVID-19, and we have now enough data, that more than 85% of people will recover without any really specific treatment in the form of remdesivir, steroids, or any other drugs that we are talking about. Most of them will have features which will be like a common cold, body aches, fever, sore throat. Some may have gastritis, and over a period of 5 to 7 days, they will recover with just symptomatic treatment, which means just taking paracetamol, keeping yourself hydrated, doing your regular exercise, taking your vitamins, and just being positive about your health. It's only 15% of people who may go on to what we call moderate disease, where your oxygen saturation may fall, or you may have high-grade fever, and there may be markers to suggest ongoing inflammation. Now, it's only in that percentage of people who have other features to suggest that the disease has progressed that we need to give treatment in the form of remdesivir, steroids, anticoagulants, and sometimes we also give convalescent plasma. There is a lot of fear that now what is the point in getting vaccination, because I know a person who got vaccinated and even after 2 weeks of vaccination, he got COVID-19. The vaccine prevents you from getting disease. It may not prevent you from getting infection. And we must understand the difference between the two. The vaccine will prevent you from getting disease in the form of severe illness, hospitalization, going into the ICU, or even dying from COVID-19. We know that it has a good protection in majority of people as far as the vaccine is concerned. But in some, you may still get, when you are exposed to a patient with COVID-19, the virus may still come in your nose and throat. It may multiply there for some time, but the antibodies which have been produced because of the vaccine that you've taken will not allow the virus to further replicate, and it will not allow the disease to become more severe, and therefore you will be saved. But during that time, your RT-PCR test can be positive and you may be infectious to others. Therefore, it's very important for all of us to understand that even after getting the vaccine, we may have a positive COVID report and we will also be infectious. So wearing a mask even after you have become COVID positive, after you got your vaccine, is very, very important to protect your near and dear ones, your family members, your colleagues, because they may not have been vaccinated or their vaccine may not have been completed in terms of both the shots, and they may be susceptible to the infection. Therefore, please remember that masking is still important even after you've taken your vaccine.